Now, we have a new participant, if that's the correct words today. Miss Freeman. Sorry, Barani. I do beg your pardon.
Right, thank you. Good morning, my lord. Today we have 4 witnesses. The first witness is Lucy Holly Challoner. And for reference, her statement reference is SCI WT 0358501.
Very good. Thank you.
Thank you.
Now, good morning, Ms. Challoner. Please come in, take a seat, make yourself comfortable, and Ms. Barami will ask you some questions. Thank you. When you're ready, Ms. Barami.
Thank you. Good morning, Ms. Challoner. Could you confirm your full name, please?
Yep, Lucy Holly Challoner.
Thank you. And how old are you?
25.
Thank you. And the inquiry has your contact information. You've recently graduated from university and you're working within the learning disability team of a local authority, is that correct?
Yeah.
Thank you. And you're here to give evidence today about your mother and your grandmother, both of whom were in care homes during the pandemic. Is that right? And you've provided a statement to the inquiry and we've read through that and we're grateful to you for providing that. I just want to remind you at the outset not to mention any names during your evidence. There is a restriction order in place to prevent that.
That's fine.
Now, we know from your statement that your grandmother sadly died during the pandemic and the cause of death was Alzheimer's disease. Is that correct?
Yep, that's correct.
And going back, I understand from your statement that your dad sadly died by suicide when you were 10.
Yep, that's correct.
And since that time, your mother struggled with her mental health.
Yep.
And alcohol use.
Yep, that's right.
And you, at that time, tried to get help for your mother, but she was reluctant to accept that help.
Yep.
Is that right? And so you and your brothers essentially became unpaid carers for your mother from that time.
Yep.
From that young age.
Yep.
Then in 2016, when you were 18, your mother was admitted into hospital for 2 months, and there she was diagnosed with alcohol-related brain damage. Is that right?
Yep, that's correct. She was really unwell at the time.
Thank you. And I understand from your statement that the prognosis was that the damage shouldn't become worse if your mother abstained from alcohol use.
Yeah, so alcohol-related brain damage isn't progressive if you stop drinking alcohol.
And with the right care and treatment, it's even possible for individuals to have some form of recovery. Is that correct? Yeah,
that's correct, if they get the right help and support in place, yeah.
Thank you. And after 2 months, your mum was discharged from hospital and moved to a residential rehab unit. Is that right?
Yeah.
And she stayed there for 1.5 years. And during that time, you applied for a court guardianship order as your mother had lost capacity.
Yeah, that's correct.
And a power of attorney, of course, wasn't in place. And at that time, you were studying at college and living with your younger brother in the family home.
Yeah, that's right.
So you had those additional difficulties, additional responsibilities to balance alongside that. And given your mum's young age, I don't think I've covered it. Could you tell us, how old your mum was in 2016?
I can't remember off the top of my head. She would have been about in her 50s, so relatively young. And alcohol-related brain damage is a condition I'd never heard of before. There's not much awareness of that condition, so at the time when she was very unwell, we knew she was drinking a lot of alcohol, but we didn't quite know what the cause was.
Yeah.
There was a lot of issues with her memory, her mobility, and lots of changes took place. So when she was diagnosed with that condition, it was the first time I'd ever heard about it.
Yeah. Yeah. And given your mum's young age at that point, it was difficult to find a care home that could meet her needs.
Yeah, that's correct, because she was quite young, and a lot of the care homes are more catered towards elderly people. It was really difficult to find a specialist placement that would give her the right care and support that she needs.
Yeah. And were you involved in the process of finding a suitable care home?
Yeah, I was supported by social work, and we travelled around quite a lot of Scotland, visiting several different care homes. I think we probably visited around 10. So visited lots of different care homes to try and find the most suitable place for her, considering her age and her condition, and the specialist kind of support that she needed. So that was extremely challenging due to the lack of specialist services in Scotland for that condition.
Yeah. Yeah. And I think, were you around 20 years old at that point?
I think I might have been slightly younger. Yeah, I think I was 19. 20, yeah.
Okay. And so at that point, you found a care home for your mother, but after a couple of years, for certain reasons, she had to move to another care home, and that was in February 2020, just before the pandemic took hold. Is that right?
So, yeah, we couldn't find an appropriate service in Edinburgh, where my mum grew up, so we had to look at different local authorities in different areas. She moved to a care home there, but it wasn't really like a long-term placement. She stayed there for around 2 years and then moved on to another care home, which she was in when COVID happened.
Yeah. Given the... Sorry, yes. So with that experience in mind, of having to get a court order for your mother, when it came to your grandmother, you put in place a power of attorney to avoid that issue, is that right?
Yeah, it was something I never really thought about. Like I said, I was quite young at the time. You don't expect to be taking on those responsibility for family members at that time, but when we got mum's guardianship order and we didn't have a power of attorney in place for my gran, we thought that's the best thing to do, because guardianship, it's a lengthy legal process, and my grandma still had capacity to appoint somebody at that time. So, yeah, that's when we got that in place.
Yeah. And what were your grandmother's living arrangements at that point?
She was living in her own home. She was actually still fairly independent at that time. She was fairly elderly and frail, but yeah, she was living in her own home.
When the pandemic started?
Yeah, when the pandemic started.
And then, but did she start finding it more difficult as well?
She did, yeah, and she had dementia, and that progressed over time, so she ended up getting home carers in to give her a little bit of support. So, yeah.
Yeah. And then I understand from your statement that she struggled with the stairs in her house.
Yeah, she did. Her mobility declined quite a lot. She had a few falls as well, so yeah.
And as a result of those falls, had to be admitted to hospital.
Yeah.
Is that right? And she was there for a couple of months.
Yeah.
And that was in May 2020, during the pandemic.
Yeah, there was a big deterioration in her there. With her dementia, things kind of got worse very quickly during that time. Her mobility, her memory, things just deteriorated quite quickly.
Yeah. And you were, you know, with your mother in a care home, you were the one to take her clean clothes and visit her in hospital, meet any needs that she had. Is that
Yeah,
right?
so when she was in hospital, I was allowed to visit and take in clean clothes. We did have to wear like the masks and PPE and stuff, but I was allowed to visit her in hospital during that time, yeah.
And from hospital, she was transferred to a care home.
Yeah.
Is that right? And we'll come on to discuss your grandmother's time in the care home, but we'll first focus on the care your mother received in the care home. Now, the second care home, the one you selected just before COVID for your mother, had 2 buildings, is that right?
Yeah, that's right.
And the building that your mother was in was for people with alcohol-related memory issues.
Yeah, that's correct. Yeah.
Now, you mentioned in your statement, and we spoke about it just briefly, that with the right care and treatment, there could be some form of recovery for individuals. Was this care and treatment to be provided by the care home for your mother?
Yeah, and a lot of that kind of recovery-based work involved her going out in the community. For example, going swimming, out to the shops, really just regaining independence. Back when my mum first got unwell, her mobility was extremely poor. She was very underweight. She was in a wheelchair, but as her recovery progressed, she was able to become a bit more independent with mobility and stuff. So going out for walks and stuff, that really was a big part of her care plan.
Yeah, great. And so there was a care plan in place?
Yeah.
Do you recall how many hours a week that care plan provided for?
I can't remember off the top of my head, but social work had put in hours for some one-to-one to take place for that support.
And did you apply for further hours?
So those further hours were added when she first went there, to get some one-to-one and to go out and about in the community.
Okay. Did you initially have concerns about the level of care given to your mother?
At that care home, no, I didn't.
Okay. Did that change as the pandemic went on?
Yeah, due to the restrictions that were in place, not being able to go out and access the community. When the restrictions came into place, she wasn't allowed to leave the care home, so that changed a massive part of her routine. I wasn't able to visit. Before I would visit, we would go out to the shops, go out for a walk. She really loved nature and trees and all that kind of stuff, so that was a massive change to her routine and the care she was receiving, because she wasn't allowed to do that because she lived in the care home.
Yeah, and I think you mentioned in your statement that initially she also went swimming.
Yeah, she loved swimming. So.
And did you believe at the time that these activities together could make a real difference to your mother?
Oh, 100%, definitely, particularly with the mental health difficulties my mum's had over the years, and with her alcohol use. Exercise and going out and about, that really does help her mental health. So yeah, that was a big part of it.
And did you have any particular fears about a decline in her mental health?
Yeah, definitely. I mean, particularly when it's someone with alcohol-related brain damage, there's always that risk of relapse. If their mental health takes a dip and she was to go back to drinking alcohol, that has significant impacts on her memory, her mobility. So not getting that right care and support and structure and routine in her life, that could cause serious consequences.
Yeah, thank you. Now, when the restrictions took place, did your mother understand what was going on and why?
She did understand about the virus, and she watched the news, and the care home spoke to her about it. So yes, she did understand.
Yeah. And before the pandemic, how often did you visit your mother?
Weekly, yeah, just whenever I wanted. It was none of the booking a visit. You could just come, you could go. I would have tea with her, have a meal with her. It was very relaxed, so yeah, weekly.
Okay.
But we would mainly go out of the care home because she liked being out and about, so we wouldn't just be sat in our room the whole time. We would go out and do things, and she got really excited for that. I really enjoyed it, so you could see the benefits from that.
Yeah. So you were providing quite a lot of stimulation and variety for her?
Which is really important for people with that condition, to have stimulation to keep the brain growing and, you know, maintain more independence and stuff like that. So, yeah.
Yeah. And then with the restrictions that the amount of times you were able to visit your mother reduced quite a bit?
Yeah, significantly, and she wasn't allowed to do the things that she was able to do. Other people in society were able to go out for their daily walks. People in care homes weren't able to do that.
So both the quantity and quality of the visits changed significantly?
Yeah, so it was garden visits that I was eventually given, and that was for half an hour.
Okay.
At first it was only allowed to be one person that went, which caused tension between me and my brother, because as you can imagine, you both want to see your mum. You've not seen her in that many months, and then you've got to decide who's the nominated person going to be. So yeah, it was, when I eventually got to see her, it was garden visit.
So you were living at home with your brother. It was just the two of you.
Yeah.
So how did the tension manifest? Were you having disagreements with your brother? Did it make
Yeah,
your
definitely.
living situation awkward?
I mean, he wanted to see his mum. We hadn't seen our mum in so long, and we both love and care about our mum so much, and we were seeing her, and obviously with my mum's health, when she was very unwell, we have both always worried a lot about my mum. So yeah, it was a difficult situation, but I think because I was the guardian, we sort of decided it would be me that would be doing the visits, which probably made him feel quite left out.
Yeah, but that's the choice that you had to make at that time. And you were travelling from Edinburgh to Glasgow to see your mother, is that right?
Yeah, that's right.
How long did it take you to get from your home to the care home?
Probably about an hour and a half.
Okay.
Quite a long time, and then when you got there, you had a garden visit for half an hour. So quite a bit of travelling to see your mum for half an hour, and then you're all the way back again.
Yeah. And am I right in assuming that the care home wasn't able to make any exceptions and allow you longer time with your mother at that point?
No, I mean, I think there might have been a few times where I got slightly longer than half an hour, but I suppose that was the rule in place. I don't know if that was the Scottish Government guidance or public health guidance. I'm not too sure what the guidance was at that time, but yeah, it was. We were allowed half an hour garden visit.
Yeah. And was your mother's stay in that care home to be permanent, or was there an intention for her to gradually transition to the family home?
So I think with alcohol-related brain damage, because it's not progressive, there is the ability to make some form of recovery. So we were kind of just going to see how things went and monitor and review the situation. So, yeah.
Were you, I think you mentioned in your statement that you had sleepovers at one point before the pandemic?
So we had one sleepover before the pandemic, just to trial how things would be being back home. So we had one sleepover that took place, but then COVID happened very soon after, and that wasn't allowed to happen again. But in an ideal situation, we could have had more of that, because that was really good family time.
Yeah. And when you were visiting your mother, who provided you with information about visiting? Did it come from the care home? Did you have to find out things yourself?
It would come from the care home, but then I would you would hear lots of things in the media or within groups and stuff. The guidance was changing that much back then. It was hard to stay on top of what the rules were and who was saying what. So, yeah, that was very confusing for families.
Yeah. So, when you say it was hard to keep track of who was saying what, are you saying that there was, at times, at least a difference between what the care home was telling you the guidance was and what you were perhaps reading online?
Yeah.
Or hearing directly from the government?
Yeah, definitely. It seems like different areas of Scotland and different care homes, some people were getting garden visits that were lasting a certain amount of time, other people were getting different visits, so yeah, it was confusing.
Yeah. And with the distance between your home and your mother's home, did you attempt video calls?
Yeah, we bought my mum an iPad and we did FaceTime.
Yeah. How was your mum with the iPad?
She was okay, but it's not the same as being in person. But yeah, we did use that quite often.
Yeah. And you mentioned the care plan that was put in place for your mother, and with the restrictions starting, a lot of the plans in the care plan couldn't be adhered to. What alternatives, if any, were put in place? How did her care plan evolve?
I think the care homes were extremely limited at that time because they weren't allowed to take the residents out. I believe that there was activities put on, but I did notice a difference in my mum's mental health, and I think she was isolating herself a bit more because she was just down about the whole situation, not knowing when she was going to see her family again, feeling sort of trapped and locked in. So yeah, I think that made her feel pretty low and frustrated.
Did she feel that she didn't need to be in the care home? And
yeah, so that was another difficult thing. The situation's quite complex. My mum did not want to be in a care home, so she didn't want to be in a care home anyway, but being in a care home during COVID when you're locked in and you're not allowed to see your family, you can imagine that just make things 10 times more challenging because your routine's been changed.
And did she ever speak to you about what there was for her to do in the care home?
Yeah, we spoke pretty much every day. I think she did quite a lot of colouring in her room, and there was bingo. There were some activities, but like I say, her mental health took a dip, and I think she was staying in her room quite a bit, feeling quite down about the situation. But the care home did have some form of activities on, but because I wasn't there, I couldn't say for sure what was going on.
Now, you mentioned that you were allowed to have garden visits with your mum. What form did they take?
So it was a half-an-hour garden visit where you would go out to the garden and you had to be sat away from each other in your chairs. You had to have the PPE on. You weren't allowed to touch or hug or anything. So as you can imagine, you've not seen your mum for a very long time, and then the first time you do see her, you're out in a cold garden, got a distance away. You're not allowed to do that natural thing of giving somebody a hug. So it felt very kind of quite awkward at times.
And was a member of staff with you throughout that, or were you given privacy?
Luckily, we were given privacy, but the staff member would take us in, take us to the seat, explain, you've got half an hour, here's your visit. So yeah, we luckily did have some form of privacy, but I suppose you're still out in a public garden and maybe people are walking past, so I wouldn't say that's full privacy, but there wasn't a carer standing next to us.
Yeah. And did those visits, were you able to continue those visits right the way through during your mum's time there, or?
I believe they stopped for a while because there was a COVID outbreak. So I can't remember the period of time or the dates, but they did stop at some point because there was COVID in the care home.
Yeah. And you mentioned in your statement that for a while at least you had essential visitor status. How did that come about? Did you have to ask for that? Was it offered to you?
Do you mean for my mum?
Yes, to visit your mum.
I think, no, it wasn't offered to me, no. The essential visiting status, it was like this kind of, it felt to me like this hidden kind of secret. So I found that out through online groups. That wasn't information that was provided to me.
And when you approached the care home with that information, were they quite forthcoming with that, or?
I'm trying to think back the way I asked about essential status for my mum. I don't know if I emailed them about it. I'm just trying to have a wee look at my statement just now.
Sure, I think it's at paragraph 68 and 69 of your statement. You talk about that. It's paragraph 70 and 71.
Okay. I don't know if that part, I was maybe speaking about my grandma when the essential visiting was given to me and then taken away.
Right, okay. It's in the section of your statement under your mother's heading, but it, you know, if that doesn't accord with your recollection, it could be that there's an error, which we can clarify with you later.
Oh yeah, no, I see now, yeah. So I had essential visits and then I had them removed, yeah. Yeah, no, that's correct, yeah.
Yeah. Okay, and you say there that you were, as the restrictions changed and your status was taken away, you were worried about challenging the care home. Can you tell us some more about why you were worried?
I think my mum had just moved into the care home, so that was a big factor. You're trying to build a positive relationship with the staff and, you know, it was a difficult situation for the care homes to be in. I think they were under a lot of stress and pressure. So also when you've got somebody in a care home, and particularly during COVID, you were hearing about the possibility of people being moved out of the care homes if you push too far or rock the boat too much. So it's an awkward situation to be in because you're trying to keep a good positive relationship with the care home, so you don't want to push things too far.
And did you hear about that, about people being pushed out through the online groups?
Yeah, through the media, yeah.
Right, okay. Now, when you, did you ever challenge them about the visits? I mean, you'd asked for essential visiting status, for example. Were they difficult to deal with at that point, or did you find that they were quite flexible then?
I think it would just go back to this is what the guidance is, or this is what public health have said. So, yeah, when I did challenge or ask questions, it was just these are the rules and we have to comply. So our hands are tied, sort of thing.
Okay. And before visiting, were you expected to take a COVID test?
Yeah.
What was the procedure around that? Did you take it before you left? Did you take it at the care home?
I would take it before, and then you had to like register it on your phone, and then you would show the proof, and then you had to fill a form out and stuff when you got there.
Okay, so each time before you left Edinburgh to get to Glasgow, you would have to go through that every week?
Yeah.
And I think we've covered that. So you mentioned in your statement that you became aware that the Scottish Government guidance for under 65-year-olds in care home settings allowed walks, and you'd mentioned before how important going for walks had been for your mother's recovery. Did you try to arrange walks for your mother while she was in the care home?
Yes, I did, and that was never allowed. I believe I wrote an email to the care home citing the government guidance and my mum's age, and that I thought that she would qualify for these visits. I can't remember what the response is or if I've submitted that with my evidence, but for whatever reason that never happened. That wasn't allowed, so we never were able to go out for a walk.
And you're not sure why they weren't allowed at the moment?
I have a feeling it might be because public health said something or the Scottish Government said something. I think we need to remember at that time there was lots of information coming from different people. So I don't know if it was maybe something about public health hadn't said it was allowed, but I definitely did request it and cited the guidance, but for whatever reason that never happened.
Sure, thank you. Now, was there ever COVID in your mother's care home?
Yeah, there was.
And was it in her building?
No, it wasn't.
Did visits to her building stop though?
Yeah, and I believe that was following public health rules.
Okay. And how long were the visits stopped for, do you recall?
I don't know if it was a policy in place for 28 days. I've maybe wrote about it somewhere in my statement. I can't remember off the top of my head, but I think it was a policy if COVID was in the care home, they would have to shut for 28 days.
Yeah, that is the number that you mention in your statement as well. And given that you were travelling between two cities and for a while there was a tiered system with different local authorities potentially being in different tiers at the same time. Did you ever face problems getting from Edinburgh to Glasgow?
Yeah, I think I had to speak to the care home about it, and I think I had to dig deep into some guidance or something where it said that you were allowed to travel between the two tiers because that was considered essential travel. So I think I had to find that guidance and then say, look, this guidance allows me to do it. So, yeah.
Had they challenged you on that point?
Yeah,
then?
I think it was by email or, yeah.
Reading through your statement, it seems that you felt often that it was up to you to determine or work out what the guidance was and explain it to the care home and others in positions of authority. Is that a reasonable understanding?
I think it was very confusing because you were seeing the guidance implemented in different ways across Scotland, and because I was a part of that group, a lot of us were speaking to each other, supporting each other, so you thought, how come that person's got this type of visit but I'm not getting this visit? So yeah, it was very frustrating and confusing to keep up with the guidance, and I think the guidance was changing that much as well. It wasn't always clear what the rules were, and because it was just guidance, it seemed to me anyway that they'd put the guidance out and it was up to the discretion of the care home to make their own rules from that guidance.
In your statement, you mentioned that it felt to you like a postcode lottery. Is that correct?
Yeah, 100%, definitely. It was very confusing because, like I said, people were getting different visits. Some people were getting this time, other people were getting that time. So I think it just depended on the care home and how they chose to implement it. I'm not sure what they were getting from Public Health or the Scottish Government at the time, but that's how it felt to me, yeah.
And then the time came in December 2020 that you decided to take your mother out of the care home and move her back into the family home. Is that right? Can you tell us what led you to that decision?
So the reason behind that was I had my grandma in a care home in Edinburgh and my mum in a care home in Glasgow. They were not allowed to see each other at all. There was no guidance or no consideration or thought given for people who had somebody in one care home and in another. My grandma had a progressive illness, dementia. She was about 98 at the time in a care home in Edinburgh. My mum's in a care home in Glasgow. With dementia, every minute counts. And I think once you go into a care home with dementia, the statistic is you live for around 2 years. I can't remember it off the top of my head, but it's a progressive illness. Every moment counts. If I didn't have my mum move home at that time, she would have never seen her mother alive again. Yeah. So my grandma was in her late 90s, deteriorating quickly. They were unable to see each other. The only way that my mum would be able to see her mother again before she passed was if mum moved home. There was no flexibility, that was the only option that we had at that time. So that's why the decision was made.
Thank you. And what did that move home mean for you and your brother?
A massive change. It wasn't planned. That wasn't what I had planned to do. I was still studying full-time at the time. We knew as well with COVID the community services were limited. So we knew and we were told by social work, if you make this decision, we can't get you a care package instantly. And they did have a chat with me and said, I don't know if this is the right thing to do. I understand your thinking by it, but the pressure that's going to put on you and your brother, the fact it's COVID, we can't get a care package in place. There's a lot of risks to her moving home, relapsing from alcohol, mental health dips, so on. But at that time, I felt there was no alternative and there was no, I felt it had to be done due to the restrictions that were in place.
And if the restrictions hadn't been in place and your mother was going to come home, I think you mentioned that that would have been done on a more phased basis through sleepovers.
It certainly wouldn't have happened at that time anyway. yeah, it's something that we did not plan to happen at that time. The timing really wasn't great, but there was no alternative. But if COVID wasn't in place, we could have done a phased return home with sleepovers, trialling it, rather than just, you've been in a care home. And I think what we need to remember as well is when somebody goes into a care home, it's usually a last resort. The community options have been tried. If somebody's been assessed as needing a care home, their needs are quite high, and that's been a decision made for a reason. So, yeah, if it wasn't for the restrictions, that wouldn't have happened in that way, and we could have done a phased return home, and I think that would have been better for my mum and better for the family, because it wouldn't have been as much pressure. And the fact we had to wait so long for a care package, that added extra pressures. But I was made aware of that, and I knew that was a consequence I had to face.
Do you recall when a care package was eventually put in place?
About a year later.
A year. And what effect did that have on your studies?
Well, because of COVID, my studies went online, so I was able to be in the house with my mum at all times. So in a way, it wasn't good that I was doing the online learning and because of COVID, but I needed to be there with my mum, and I was sort of, so it was online learning, so I was with my mum at home, so I was able to be with her. And she needed somebody with her at that time, because if you imagine, you've been in a care home, in 2 separate care homes for years, and then all of a sudden you're back home again and you've not got that support level that you had before. You've got your 2 children, but that's all you've got. So it was a massive transition.
Thank you. Now, if we turn to look at the care your late grandmother received, your grandmother, we mentioned, was admitted to hospital in April of 2020, and then to a care home in Edinburgh in June of 2020. You told us, I think you told us that you had to choose a care home for your grandmother as well. With your mother's care homes, you mentioned that you visited lots of different care homes across Scotland. What was the process in finding your grandmother's care home during the pandemic?
It was very different. I wasn't able to go out and visit any care home. So the first care home that my grandma went to, that was a safe haven placement. So she had been assessed as being medically fit for discharge, but we knew at that time going back home wasn't an option because her needs had increased so much, and her dementia had really deteriorated. So we knew she needed a care home, but we weren't allowed to go and visit, go inside the care home. So it was a very different process, and you didn't have much choice, or, I mean, you did have choice because I was the power of attorney, I had to agree to it, but I wasn't able to go in, meet the staff and have a walk around like I did when I was visiting care homes for my mum.
And you mentioned a safe haven. What does that mean?
So I think it might have been a policy that came into place because of COVID. I'm not 100% sure, but it was to get people out of hospital if they were medically fit for discharge. If they knew they couldn't return home, it was to go to hospital and then you would go there, but it wasn't permanent. It was just sort of like an interim thing.
Okay, thank you. And what did you, since you weren't able to visit the care homes, how did you have to make your decision about where your grandmother would go?
Looking online at Care Inspectorate reports, looking at the websites. Yeah, that was kind of the only
Was
way.
that simple and straightforward for you to look through these reports?
Yeah, but I think sometimes you need to visit the place to get a feel for the staff and see the building. It's a massive decision that you're making. That's somebody's life, and they're going to be living there for a long period of time. That's your loved one that's going to be living there, so you want to make sure it's the right fit, but due to COVID, you weren't allowed to go and visit. So.
Yeah, thank you. And when your gran moved into the care home, were you allowed to start visiting straight away?
No.
What was the issue, and when were you allowed to start visiting?
I believe at that time when they first moved there, they had to isolate. I don't know if you maybe go to my statement if I go into depth about that.
Yes.
But yeah, I wasn't allowed to visit straight away, and when I was allowed to visit, it was a garden
So,
visit.
104. Thank you. Yep. You mentioned, yes, that there was a 2-week isolation period, and you weren't allowed to see your gran even for garden visits outside.
Yeah.
But after the 2 weeks, those visits were allowed. So during the first 2 weeks, there was a risk that you might pass on an infection, even with all the precautions. But
Yeah,
after
I
the
think-
2 weeks, that concern disappeared.
Yeah, I think it must have just been another bit of guidance that was in place, but that must have been extremely confusing for my grandma because she's been in hospital, then she's moved to a new environment with different people she's not met before in a new place, and you're not allowed to see your family for 2 weeks, and you've got dementia. That must have been extremely confusing and frustrating and distressing for my grandma.
Did the garden visits remain? Did they continue? Or
So at first it was garden visits, which were absolutely horrendous. They were extremely distressing for me and my grandma. My grandma was in her late 90s at the time. She had difficulties with communication. So wearing a mask and being out in a cold garden, when I visited, there was like a gate in place, which sort of reminded me a bit of like a prison. So my gran was on one side and I was on the other side, and the communication was so difficult. I was having to shout, she couldn't understand, she would say, "Come closer." The whole thing was just really distressing, and I left so many of those visits crying in tears thinking, what have I done to my grandma? So.
Thank you. Could I ask you please to read paragraphs 106 and 107 of your statement?
106, did you say?
Yeah.
Am I allowed to say the name?
You're allowed to say the name of the care home, but not any.
Okay. The visiting at North Care Home was in the middle of a reception area with people coming in and out. This was when the visiting moved from garden to inside, by the way. At first it was garden, and then eventually it went to you were allowed indoors. I would be seated across the table from Gran. As it was in the reception area, delivery drivers would be coming in and out. People were just walking here, there and everywhere. I felt this was not an appropriate place for visits. I would be trying to speak with my gran, and she would get so distracted with all the people going about. My gran also thought that the people visiting were about to tell us that our visiting time was up and ruin our visit. We never had privacy. If my gran wished to communicate something with me in private, she couldn't. Having visits in a reception area like that was very degrading.
Thank you. And could you read the next paragraph as well, please?
Yeah. I also had garden visits where both me and my gran would be behind gates. The staff would bring my gran out in a wheelchair. At the end of visits, gran would cry. It was traumatic. She would scream. It was bad.
I think that's what you were touching on before. Are you able to expand on why your gran would cry and scream?
Because she was so confused. She didn't understand where her family had gone, why she couldn't go and see them, why these members of staff were wearing masks. She was extremely distressed. She didn't want to be in a care home, and she didn't think she needed to be in a care home. So, as you can imagine, it must have been very distressing, and we were all very close to my gran, and usually when you would go and visit, you would hear about her life stories, take your time. You were out in a freezing cold garden with a gate there. You could barely communicate or hear each other. It just wasn't effective for either of us. It was it was nice to be able to see her, but the way the visits were set up, I think, caused a lot of distress for the both of us, because you weren't even allowed to give that hug and that reassurance. Every time I would see my gran, you would give her a big hug, hold her hand, give that love and affection, but you were outside in a freezing cold garden behind a gate shouting. So it didn't feel very dignified.
Thank you. And could you read the next paragraph as well, please, 108?
Yeah. If the pandemic never happened, I would have been visiting Gran in her room in private. I would also have photographs to look at with Gran. If Gran was to get distressed, I would then have the photographs to help calm her down. These were my props. I had strategies for her dementia. I was not allowed to use these. Instead, I was sitting in a busy reception. I couldn't take things in. If you did wish to take things in, like a gift, then it had to be disinfected and left for 72 hours.
Thank you.
So yeah, that was a massive part of my Gran's dementia. We made lots of memory photo books, and she had lots of stories she would like to tell, and you could sit and talk to her for hours, and she really benefited from that. And if she did get distressed with her dementia, that would be a distraction technique, and you could calm her down and reassure her. When I was sat at that reception, I didn't have any of that, and she didn't understand why she was in a care home. She was asking me, when am I going to get home? What's going on? What is happening? When am I going home? So you didn't have these photos to redirect and calm her down and speak about something more positive. You were in a reception, had people coming in and out. You didn't know when your time was going to be up. So, yeah, I think it was extremely difficult for my grandma.
Yeah, thank you. And you mentioned that she found the use of masks difficult, and you say in your statement that she was paranoid about people laughing at her behind the masks.
Yeah, she didn't understand the use of the masks, and I don't know if that was a part of her dementia and her decline, but she felt that people were laughing at her behind the mask, which must have been a very awful feeling, and a very scary feeling as well.
Yeah. And you mentioned that even at a distance you weren't allowed to lower your mask to smile at your gran. Yeah,
so she couldn't see people's facial expressions, and I think that's quite a big thing for people's communication. You can't see if someone's smiling or whatever. You could barely hear people either with the masks. My gran was deaf and she didn't like wearing a hearing aid, so communication was difficult without the mask. Adding the mask onto that made it even more.
Was there any discussion about the use of clear face masks?
No, that was something that never happened. I don't know why that didn't happen. I think that would have been really beneficial to happen, but maybe the guidance didn't allow it, or I'm not too sure why that didn't happen, but it was always the blue masks that we had to wear.
And your grandmother's care home was in Edinburgh. How far away from you was it, and how did you get there?
Probably about a 40-minute walk, and I would just walk there.
Okay. You didn't ever take public transport?
No, I don't think so.
Okay, and I think you say in your statement that's because you were concerned about picking up.
Yeah, because I think you were just so scared at the time about if you brought a virus in or whatever, so you wanted to stay away from people. And my gran was in her 90s. I was terrified if she catches COVID, what's going to happen? She was very vulnerable, so yeah, that was something you were always scared of as a family member. What if they catch COVID?
Yeah.
Minutes exactly. I'm going to have 2 minutes for when I'm going to ask everyone to stand up for Amherst to stay. So just to warn you that that's coming, you're not taken aback.
Thank you, my lord. Now, at paragraph 115 of your statement, you mentioned that you felt the restrictions were far too restrictive for a woman of 98 with dementia who was deaf. Which restrictions did you think were too restrictive, and what do you think would have been appropriate?
The place that the visits took place, the garden visits, I didn't think that that was appropriate to have somebody out in the cold behind a bit of gate. So yeah, the places of the visits, the fact they were at an open reception, you're meant to be having private family time, and you're in a busy reception where people can listen into your conversations, and the time just goes so quickly. Before you know it, that's your half an hour up. It takes when I would first go there, my gran would be happy to see me, but also asking me lots of questions about what is going on, what's happening, when am I getting home. So, yeah, the place that the visits took place and the timings, I thought that wasn't right.
Thank you. And you say in paragraph 117 that you were concerned about whether your gran was getting enough stimulation and the length of time she was spending in her room. What caused those concerns?
Well, I'd never been in the care home, really. I didn't really know the staff. I wasn't really getting much feedback, actually, about what was going on in the care home, really. So that was my worry, that she was sat in a chair in her room on her own, confused. Why am I here? Where are my family? And what's going on?
And did you raise those concerns with the care home? And please don't mention any names.
Yeah. I can't remember at the time. I think what you need to remember as well is we understood there was a lot of pressure on the care homes and you didn't want to rock the boat or push things too far. But I would phone up and ask how she was, but it would usually just be, she's fine, she's settled. That was kind of the feedback you would get at that time. So.
And you mentioned that in respect of your mother, you were concerned that the care home might ask your mother to leave. Did that also apply in the case of your grandmother?
Yeah, definitely, because they've got the power to, you know, they could move your loved one out of that care home, you know, anything could happen. So, like I said, you didn't want to push the boat too far or offend anybody, but then also you want to make sure that your loved one's getting all that they need. So it was a difficult situation to be in.
Thank you. And I understand that eventually your grandmother moved on from that care home. In September 2020, she moved to a different care home in Edinburgh.
Yeah.
Is that right? Could you tell us about the reason for her moving?
So, because the first care home she was in, that was a safe haven placement. That was never a permanent place. That was just in place to get her out of hospital and it's somewhere else. So, the second care home, that was the one that we chose where we were like, right, that's going to be the permanent one that she'll move to.
And you mentioned that a local authority care plan was again put in place, but that you also typed up your own care plan for your grandma. Is that correct?
Yeah, so I made like a wee book and a document about like my gran's life, how she grew up, what she did for a career, family photos, what music she liked. She was a concert pianist, so she loved her music, so I wrote all of that kind of stuff, how she liked to drink her tea, and stuff like that, just so the carers had that to refer to and to get to know my gran, really, because we couldn't be there to do that. So.
Yeah. And was the care home grateful for that?
Did I think that
use
helped.
Your plan? Yeah. And how did the communication compare to the previous care home?
It was better. The communication was much better. They updated me how she was settling in and stuff. So yeah, that helped me and I think my gran.
Yeah. And you mentioned that in the first care home you didn't see much of the home at all. In the second care home, I understand that you were able to go and help your grandmother unpack and get settled in.
So we were allowed to go into her care home eventually. At first it was a window visit that was allowed, and that was a closed window visit. So you weren't allowed to go inside and the window was actually shut. She was on the ground floor in our bedroom, and that was another reason why we chose that care home, because we'd been told if something happens you would still be able to see her at the window because she's at the ground floor. But yeah, I was then allowed to go inside and see her room at a later date.
And you mentioned that you were able to set up her room. Did that make a big difference to your gran?
A massive difference, yeah. We got lots of photos on the wall, personalised blankets with photos, her music, all that kind of stuff. So we tried to make it as homely as possible for her, and I think that brought some comfort to her.
And when you had the closed window visits, did your gran have trouble hearing you, given her hearing difficulties?
Yeah, it was extremely difficult, and at that time I'd actually bought a device for my gran. It's called like an Amazon Alexa, and it was in her room. So when I attended the window visit, I assumed a bit of the window would be open so you could communicate, but I believe it was guidance from Public Health at the time that the window had to be closed. So I was kind of a bit shocked by that. I assumed there would be a bit of the window open so you could hear each other. I was trying to shout at the window. It wasn't working, so I tried to connect my phone up to the Amazon device because I thought maybe this is a form of communication. But then she was confused because I was at the window, but then I'm trying to speak to her through a device. So it just was so distressing, and we weren't able to communicate at all. And I left that window visit and pretty much cried the whole way home because it was just so distressing and ineffective.
Yeah. So you were trying different options, but none of them were really doing the job.
And I think because my gran was in her late 90s, technology, she didn't understand phones. She would call it like a device. She had hearing difficulties, so although I tried to make it work with that device, for her dementia, her age and her needs, it just wasn't effective, but I was that desperate at the time. I was just trying anything.
Yeah. And online visits then were not really an option for you?
Yeah, just the communication. We did try, and the staff would try as well and set it up and encourage her. Sometimes it worked better than others, but I think it was certainly confusing for her because she wasn't used to using technology like that.
And after the window visits, it then changed to garden visits, is that right?
Yeah.
And were the garden visits better in the second care home?
Yes, they were, because there was a wee kind of, there wasn't a gate between you, there wasn't bars between you as if you were in a jail, so that was certainly better. But the communication, you still had to be distanced away from each other, you had to wear a mask. It was cold, so it was an improvement, but it wasn't very good.
Sure. And from there, you moved to indoor visits in a visiting pod, is that right?
Yeah, well, they tried that. It didn't really work, so it was like a room that the care home had added because of COVID, and it was like a bit of glass. I think they were trying to do their best at the time with the guidance and probably thought, right, this is a way to get them indoors, somewhere warm, but for my gran, it just caused so much. She was so confused by the glass, she was trying to knock the glass down, it didn't work. It wasn't effective for my grandma or her needs.
Thank you. And did the care home manager do anything about that following your gran's reaction?
It was after that she got we got essential visits for a period of time. The care home recognised that it wasn't working.
Yeah. And what did those essential visits mean? Where did you visit your gran?
It meant I could go into her bedroom and sit next to her and have her photos and stuff.
Yeah. Put in place the strategies that you mentioned you developed. And how did you arrange those visits?
The care home had a booking system where you had to email, and it was different slots.
Okay. How did that compare to the previous care home and also to your mother's care home? Did they use a similar system?
Yeah, they had a booking system where you had to email and confirm in advance. Okay. It wasn't just like you could say, I want to come and see my mum at 2 o'clock at this time. You had to look at what the slots were available, and when those slots came out, it was like, right, quickly get in and get what you can.
Yeah, thank you. My lord, it might be inappropriate. Or
A few seconds left. Sorry.
Thank you. How many times a week were you able to visit your grandmother in the second care home?
Oh, it changed that often. Have I wrote about that in my statement?
I think you say it eventually changed to 2 visits a week, is that right?
So I believe there was like something in place where you were allowed 1 garden visit but then 1 indoor visit. So I think eventually, I was allowed to see her like once a week in her room, and then I was allowed to have a garden visit as well as that.
Thank you. I think it might be.
Please all rise now. Observe 2 minutes silence. Thank you all very much.
Thank you, Millard. Now, you mentioned in the second care home you were given essential visitor status again. What was that process like? Was that offered to you, or?
I had to request that through an email, and I think something that's important to mention is once you got like one essential visit, that didn't mean that that was a long term, like you had the essential visit in place forever. It was kind of like you could sometimes get a one-off essential visit if you fit the criteria or whatever it was. So it wasn't just when you got essential visits, that was you able to visit whenever you want, like things could change.
Thank you. And you mentioned that initially you had a one-off essential visit, then you were given essential visitor status, but that was then removed, I believe, by an agency nurse. Is that correct?
Yeah.
What happened then, and did you challenge the care home about that removal?
I was just told that my gran was doing better and that she didn't need essential visiting anymore, which I was really confused about because she was in her late 90s, had dementia, progressive illness, so I was a wee bit confused as to why I wouldn't get that. But I think at that time I was under a lot of pressure mentally. I had my mum in a care home and I had my gran in a care home, and there was lots of different guidance and confusion going on, so you want to challenge things, but then also you didn't want to push things too far.
Yeah. And you mentioned that your gran's health then declined and you were once again given essential visitor status. In your opinion, would there have been the same decline if your visits had continued?
That's a good point to make. I don't know. Yeah, that could have been something to do with it. Yeah, I don't think it was right that the essential visits were stopped then, because my gran was really quite unwell at the time, but she seemed to have like perked up a bit, and they thought that she was doing better. But she was still kind of towards the end of her life. She was 99, so.
Yeah, thank you. And you mentioned your mum being in a care home at that point, but then there came the point where you took your mother out of the care home, and was she then able to visit? your
Yeah,
gran?
so my mum was actually out of the care home a wee bit before then, but at first it was only allowed to be one person visiting, so it took a while until my mum was allowed to be visited, to visit my gran. That was another thing I had to look into the guidance about, because my mum wouldn't have been able to visit my gran without me being there, a carer to facilitate that.
Okay.
She wouldn't have managed to independently travel there. So my mum was able to see her eventually, yeah, with myself.
With you as well. And where did the visits take place at that point?
In my gran's bedroom.
And once your gran was nearer the end of her life, were you all able to visit her, you, your mother, your brothers?
Yeah, we were. Things became more flexible towards the end of her life. She was in her bed a lot, so a garden visit just wouldn't have been able to happen. So, yeah, we were all allowed to see her together at the same time.
And you mentioned that you were able to also, by presumably doing further research about the guidance, get a visit for your gran with her Jack Russell Terrier before she passed away.
Yeah, she was able to see her wee dog that meant an awful lot to her. So I think that had to be risk assessed and stuff, but I had a discussion with the care home and she was allowed to see her dog. So that was
What was
nice.
the impact of that on your gran? Seeing all the family and her dog?
I think it was probably quite overwhelming for her, but I think, and I hope it brought some comfort to her during a really difficult time.
Thank you. And towards the end of your gran's life, did you still have to use the booking system, or was there more flexibility?
I think towards the very end there was more flexibility. I didn't have to book. It was more just speaking over the phone and getting updates, how is she doing, that sort of thing.
Thank you. And in the second care home, there came a point where your gran caught COVID, is that correct?
Yeah.
Yeah. And that was either in January or early February of 2021.
Yeah.
And you asked for essential visits in February, but you were refused. Is that right? Were you given a reason as to why?
I had asked for essential visits multiple times. I can't remember what the reason the response I would have got at that time. Yeah, I don't know if I wrote in the statement why I was refused.
I don't think you have mentioned it here.
Yeah.
So you weren't clear on
What the reason would be, no.
Thank you. And you say that following that refusal, you contacted Alzheimer's Scotland, and they were a big help to you?
Yeah, so they had a helpline in place where you could contact them and speak about the situation, and they sort of helped you understand the guidance a bit. I think the guidance was very confusing and people weren't sure what they were entitled to, what was allowed to happen, what wasn't allowed to happen, what the Scottish Government were saying, what public health was saying, what the care home were saying. It was very confusing. So yeah, I had support from them and then I asked for essential visiting again.
And that was in May 2021?
Yeah.
Where you provided evidence, you say that you provided evidence about why you should receive the visiting rights.
Yeah, it was a very long email about me justifying and evidencing my gran's needs, her situation, why she needed the visits, due to her health, mental well-being and stuff like that.
Thank you. And does that mean then that you hadn't visited your gran between January and May of 2021?
I can't remember the dates and stuff off the top of my head.
Because you meant, well, in your statement at paragraph 175, you mentioned that you'd sent an email asking the home for an update on COVID cases. This was after your grandmother had contracted COVID. And in February, you'd asked for essential visitor status. That had been rejected. Then in May, you emailed them again, explaining why you should have visiting rights. So does that mean in that intervening period you didn't visit your gran?
I think I was asking for the essential visits on top of the original visit, where I think at that time you were allowed one visit a week, half an hour.
Okay, so you were able to have indoor or garden visits, but not the
Yeah.
additional visits. Okay, thank you.
Because with the essential visits, I think they weren't to be as timed and restrictive as the other ones.
Thank you. And you say in your statement that while you weren't able to see your gran, you asked that she be provided with physio, other exercise and access to a doctor. What was the response to that? It's in, if you want to refer to your statement, it's at paragraph 179.
Yeah, so I've said that I've asked by email for her to receive physiotherapy and access to a doctor and exercise, which I received a reply informing me that the home was encouraging gentle daily exercises, and that a lot of professionals were not visiting the care home at that time. All dental and optician appointments were stopped.
Did that cause any concern for you?
Yeah, it did, because to provide some context, when my grandma was at home, she was like, her mobility was poor, but she was able to walk around. And when she first went into the care home, she was able to walk around. And there was a massive decline in her mobility. She went from being able to walk around, she did use a stick, and her mobility still wasn't perfect, but to being more in her chair a lot of the time and struggling to move. So I was really concerned about her mobility at that time and how much it had declined, yeah.
Yeah, thank you. And then you go on to say that just a few weeks before your grandmother passed away, you were able to take her out for the day. Are you able to tell us where you went and the difference that that made to your gran, to you, to the rest of your family?
Yeah, so eventually I think the guidance must have changed again, and this was a new thing that was now allowed. So I'd asked the care home if I could take my gran out for the day, which they had to do risk assessments, and we had to do tests, and all those precautions were in place. And then we went out to the Botanic Gardens and had a really nice day together with family there. I think it must have been quite overwhelming for my gran to actually finally get out of the care home, considering she had been locked in a place for so long. But yeah, it was a brilliant day. She enjoyed it. We were able to be together as a family, and yeah, it was a really special memory.
Thank you. And you then go on to mention that your gran had a do not attempt cardiopulmonary resuscitation order in place.
Yeah.
You say that you weren't aware of this, so you weren't involved in that being put in place despite having power of attorney for your gran, is that right?
I don't know when that was put in place. No discussion took place with myself. The only reason I actually found out about that was because I found it ripped up in our house. So, yeah, I'm not sure when that was put in place.
Okay, so you're not sure why it was ripped up, and you didn't speak to your gran about that afterwards?
No.
Okay.
We should really take a break for the stenographer's sake. I sense you're very close to the end.
Yes, I think maybe another 5 minutes.
I think, in fairness to Ms. Challoner, we'd just sit for the extra 5 minutes so
Thank
you
you,
can finish.
Robert.
Yeah.
Thank you. I want to move on to the impact on you, and I think it's captured here quite well. So I wonder if you could read from paragraph 182 of your statement, please.
Yeah. The stress and pressure of having two different relatives in two different care homes had an impact on my mental health. The added stress of being a power of attorney and a welfare guardian would be stressful just in normal times. However, you add in the pandemic and different people telling you different things, this also had an impact on me.
And I think you told us that the different things you were being told were by care homes, by the government, by people in online groups, and that was all adding to the confusion.
Yeah, it was extremely stressful and confusing, and because you had two different people in different care homes, you would hear one thing from this side and then kind of assume it would be the same, but that wasn't always the case.
Thank you. And could you continue reading from there, please?
Yeah. There was a lot of pressure on me. I would cry all the time. I used to snap over small things because of the pressure of what was going on in the background. I also had to deal with the tensions within the family and the arguments. There was conflict going on within family relationships. there was an impact on my education. I was meant to be studying for my degree at university. How I was meant to focus on my studies with that much pressure. I managed to gain my degree as a lot of the work was online. My attitude that I'd started the degree, so I must finish it.
If you continue, please. Yeah.
I graduated with everyone else on my course. I received support from the university. I could speak to the carers person they have there. The university put a carers plan in place for me. This meant I could have extensions if I needed them and extra help. To be fair, I got good support from the university.
Thank you. And on to the next one, please.
I had no time for friendship groups as I felt I was chasing up care homes and speaking to all the different people I had to speak with. I also had to visit homes in Edinburgh and Glasgow. I had no time. I couldn't be bothered socialising, to be honest. A lot of people my age do not have the unique family situation that I have. None of my friends are power of attorney for a parent or a grandparent. It means you can't really relate to your friends. I did have the Care Home Relatives Scotland group, and they were a good support. I would speak with members online. That was good, as I could speak to people who were going through a similar situation. We could compare notes and give each other advice.
Thank you. And when you say that you had no time for friendship groups because you were chasing up care homes, do you mean by that what you said, that you had to find guidance and contact the care homes about this, or do you mean the initial finding the care homes?
Around the guidance and stuff, I was really worried about my mum and my gran and when I was going to next see them and what was going to happen. So the last thing on my mind was going out and socialising with friends and acting like things are normal and happy, because they certainly didn't feel normal and happy to me at the time.
Thank you. And then you make a few points in your statement where you, and I think you've touched on this already, that in future you believe there should be rules for people who have loved ones in more than one care home and to facilitate visits between care homes. You also mention in your statement that you believe there should be more accountability with organisations. Is that correct? They should take more responsibility.
It felt like it always just came back to this is the guidance, but we can interpret it into our own different way. So I felt there wasn't accountability. When things were challenged, it would say, oh, it's public health that says this, it's the Scottish Government that says this, it's the care home that says this. So it was very confusing to know who was making the decisions that was having a really negative impact on your family members.
Yeah. And you say that there should be better guidance for carers so that they're regarded, for family members, so that they're regarded as carers rather than just visitors. And finally, could you please read paragraph 197 for us?
My hopes for the inquiry would be to do some things better the next time, to ensure that the country is better prepared, also to think about family members, not as visitors but carers. I looked after my mum for years, since I was 12 years of age, probably a bit earlier than that actually. I also looked after my gran for a long time, so from being a carer to a visitor did not feel right. I felt there was no empathy towards carers. I felt like the care homes were acting as if it was us against them. It should not have felt like I was fighting against care homes, public health and the Scottish Government. I think care homes and families should have been working together. I also don't think it should be a blame game. There are lessons to be learned on all sides.
Thank you. Those are all the questions that I have for you.
Thank you very much indeed, Ms. Challoner. That was very helpful. I'm very grateful for your attendance.
Thank you.
Very good. Let's try and make it just shy of 15 minutes. past. Now, Mr. Gale.
Thank you, my lord. The next witness is Alina Elizabeth Duncan. Her statement reference is SCI WT 0378 and quintuple 05.
Now, have we got anyone to get the witness? It's one minor detail. Ah, sorry about this. Could you? Yes. Ah,
She's coming.
thank you very much in any event. Now, Ms. Duncan. Now, good morning still. Make yourself comfortable, and then Mr. Gale has some questions for you. Mr. Gale, when you're ready.
Thank you, my lord. Good morning, Miss Duncan. Mrs. Duncan, I think it is, isn't it? Your full name is Alina Elizabeth Duncan, is that right?
Yeah, Alina.
Alina, thank you. And you're 56, is that right? The inquiry has your contact details. You are employed, I think, at the moment, is that right?
Yeah, on a
And
basis.
I don't want to ask the identity of your employer. Obviously, the inquiry knows that. But for the purposes of your evidence, it is, I think, useful that we know that you are a carer working in the provision of care at home services.
Yeah,
How long have you been doing that?
since the start of COVID, so
Yes.
about 3 years.
Yeah, thank you. You provided the inquiry with a written statement, I think, which you confirm is your evidence, and that it's the truth, and that you're agreeable to having your evidence recorded and published.
Yeah.
Thank you. And you're here to tell us about your husband, James Duncan,
Yeah,
who I think is known as Jim,
yeah,
and that's how you refer to him in your statement.
yeah,
And is it all right if I call him by Jim?
yeah,
Right. Now, we know from your statement that he died on the 25th of August 2022.
Yeah.
And he would have been 70.
yeah,
And that in 2008, when he was only 55, he was diagnosed with a rare form of dementia called posterior cortical atrophy. Is that right?
yes.
And you tell us in paragraphs 5 and 6 how this affected him. And I know it's probably distressing, and I don't want to go through the detail of that. We obviously know it from your statement. But taking it briefly, if I may, he was left with problems with his eyesight, insofar as it appeared that messages from his eyes were not going to his brain.
Well, from the brain to the eyes.
Brain to the eyes, sorry, obviously the other way around, yes. And also he struggled with communication.
Yeah.
And his communication became somewhat
It was
inappropriate.
non-verbal, yeah.
Now, can you tell us just a little bit about Jim before his diagnosis?
Before,
Yes, before it.
before his diagnosis, he was very active in the local community. He received an MBE from the Queen in the Millennium Honours list for raising over £150,000 to set up a hyperbaric unit for people with multiple sclerosis. He was, through his business, he worked with his father and his brother in a retail environment, and he was very well known in the local community, very active, and very well loved.
Yes. And he was also a fit and active man.
He was very fit and very active, yes.
And you also say elsewhere in your statement, it's paragraph 23, I don't think you need to look at it, but it's just a very brief reference. You say he was someone who was never ill.
No, he'd never really been to the doctors for anything before his diagnosis.
Okay. And you have 3 children, 2 sons and a daughter.
Yes,
And I think you are agreeable that you can name your daughter, and I don't want to single her out particularly, but your daughter is Louise,
yeah,
I think is a Christian name. And the reason I will just ask you about this is that you give some information later on in your statement about Jim's condition, and it relates to something that your daughter was involved in.
yeah,
And we'll come to that in due course. But I think just for present context, your daughter is a very skilled professional golfer.
Yeah.
And I think she was in contention while still an amateur in the British Open in
She
2021.
Yeah, she finished tied 10th.
We'll come to that in just a little when we come to your statement. Am I right in thinking that when Jim was diagnosed with dementia, he was still living at home with you and the family back in 2008?
He was, yes.
Yeah. And you were working at that time, not as a carer,
No.
but you were working at that time. But as you say at paragraph 9, you gave up your job, I presume in 2012, to look after him.
Yes, my mother had passed away. My mother stayed next door to me, and she was very much my main support, and she'd passed away very suddenly. I'd found her one morning, and I just felt I just couldn't do everything.
Yeah.
I couldn't look after Jim, I couldn't look after the kids if I was working as well.
Yeah. And the children would have been relatively young when your husband was diagnosed.
Yeah, my daughter was 8, my middle son was 11, and the eldest one was 14.
And I take it you became effectively his full-time carer.
Yeah.
How much care did he need in those early days?
In those early days, it was mainly supervision. He was still, because it was a family business, he was still able to go to work. Sometimes he would get the bus up, and the girls that he worked with would make sure he got the bus home, the correct bus. And latterly, when we stopped doing that, I would take the kids to school and I would drop them all at the same time. And when I say work, it was very loosely speaking. He was mainly supervised there. So by the other staff who were fantastic. And but then the business was sold in 2015, I think it was.
And it would have provided him with an environment with which he was familiar.
Yeah. Absolutely.
Now, you made the decision in 2016 to move Jim into full-time care at the Arran View Care Home in Saltcoats, is that right? And you explain why you made that decision in paragraphs 11 and 12. And I don't want to go through them in any detail, but one of the reasons that you chose that home was that Jim had had some respite care there, and the experience that you'd had there was a good experience. You tell us about the layout of the home at paragraphs 13 and following, and we can read that, and I don't want to take any of that in detail, but you say at paragraph 14 that you were not sure if Jim understood why and where he was getting moved to. You just explain that, what his position was when he was being moved into care.
His speech wasn't great by that point, and it was difficult to know what he was thinking, what he was understanding. I think he maybe did understand a little bit when he went in. It was very difficult to know what.
Yeah, and obviously the situation had become that you had to accept the need for him to move into care. Yes. Now, you tried to visit him. I think you say every day.
I did, yes.
Sometimes more than once a day.
Sometimes, if he wasn't very well, I would maybe go down 3 or 4 times a day. It was only 4 miles from the house.
And initially, you have a lot of praise for the care home, its staff, and the care that Jim was given pre-pandemic.
Yeah. Yes, the staff were fantastic. They just loved him. I couldn't have praised them any more at that time. But things did change throughout the pandemic.
And I think things changed during the pandemic, obviously because of the restrictions that were then placed upon visiting and your access to Jim, but also because the care home changed hands.
It did change hands, yes. And things started to go downhill. I was in regular contact with a number of staff from the unit Jim was in, and I could tell that, you know, there was staff shortages, you know, just things were starting to go downhill, although there was other things that improved. You know, at some point the lounge area was done up. I did buy a television for them because they didn't have remote control for their television, but things like that, some things improved, other things didn't.
And I think you set this out at paragraphs 20 and 21 of your statement, but even in the period after the change of ownership of the care home, you continue to identify particularly individual carers who were very close to Jim and very good with Jim, is that right?
I always made sure if I was sending any emails in that was always my first paragraph. Was that some of the lady who was manager in Jim's unit had been there for 25 years. She's near retirement age now and is still employed by them, although I believe she's off sick. But yeah, she was fantastic and just loved Jim to bits.
There was a care plan in place for Jim, and as we've said, paragraph 24 of your statement, you reiterate what you've just said, that you never faulted the treatment at any time before the pandemic. Can I just ask you about visiting pre-pandemic? Obviously, you visited. I visited regularly. Other family members, your children?
Yeah, my children visited. And also his brother and sister-in-law visited every Wednesday afternoon. And when he was able to, they took him out. But I had an experience where I'd taken him out. I think it was maybe 3 months before the pandemic, and he'd been very, very sick in the car. And I think I put it down to his eyesight problems and the movement in the car. So made then the decision that we wouldn't take him out. Maybe I walk round the gardens. But even in that time, his brother and sister-in-law came to visit him in his room. They put the music on. We just had some fun time. But that all changed.
Yeah. Just in relation to your children, how had they adjusted to the dementia that your husband and their father was suffering?
They have been fantastic. It was very much day to day. The eldest, he probably knew his dad a wee bit more because his dad did an awful lot with him. In fact, when I was at work on a Wednesday and it was Jim's day off, he would, you know, if it was school holidays, take them out or do something with them and make the dinner. And but obviously, then they found it. They have found it very hard, but throughout the whole thing, they have been fantastic. And they're very grown into, very well adjusted.
Yes, I'm sure. When you were visiting your husband in the care home pre-pandemic, did you assist with his care while he was there?
Occasionally I would maybe feed him or get him a drink, or no, I didn't do any personal care with him. But then when I did do some. There was one time when it was in there, just near the beginning, he had stopped eating, and we couldn't understand why. We thought, well, maybe he doesn't like the food. That's understandable. So I would make soup at home, and we would go and say, oh, "This is soup that I've made. You need to eat it." So he would eat it, and he would eat anything I took in, but he wouldn't eat what the staff would give him. And I'm not sure quite how we worked it out, but we think he actually thought he was in a restaurant,
Yes.
and he didn't have any money to pay for it. Yeah. So we put some money in his room, explained to him, that's the money for your meal, you know, just so that he knew he had something there, and that seemed to work out.
Yeah,
Totally
you tell us about that in your statement.
Yeah.
Yes. So, probably a very insightful way of dealing with this situation.
You just have to work it out day by day.
Yes.
Try and work it out what's going on.
Yeah. Right, can we go to restrictions, please? Paragraph 26 of your statement and following. The 19th of March 2020, you were made aware by a member of the care home staff who told you that they'd been at a manager's meeting and they'd been told that they were going into lockdown and you would not be allowed to see Jim anymore.
Yeah.
Was it in those simple terms?
Yeah, well, I remember saying, well, what does that mean? You won't be able to come in here. But I don't see how, to this day, I can't understand how I can't see my husband. I just couldn't understand how anybody can then decide whether I can see my husband or not. It's just beyond thinking.
I think you tell us subsequently in your statement it was a total of 17 weeks before you were able to see him again.
Yeah, I think so. I'm not sure the exact dates, but...
Well, you've given that figure of 17 weeks. I'm sure you're right.
We kind of worked it out, I think, from photographs I had.
And also at this time, you'd taken up your job as a carer.
I did, yeah. Yes.
So you would, as a carer visiting people in need of at-home care, you would be going into people's houses. I
was going into people's houses. I felt I would be bored throughout lockdown, so I thought, what can I do? So got a wee job. Sometimes I was going into 20 people's houses per day, obviously with full PPE on and taking the necessary precautions, but yeah.
Yeah. And you make an interesting observation at paragraph 29 of your statement. Towards the end, you say that you once asked some of the service users, I assume that means the people you were caring for, that if they only had a year to live, would they want to see their families even if it shortened their lives?
Yeah, every one of them said, oh yes.
Yeah. Okay. Right. As I say, you said that you didn't see Jim for 17 weeks, but there were facilities offered for you to contact him, phone calls, iPads. Were they any use?
No, absolutely not. I've never even seen an iPad, never mind. We tried, first of all, we tried the phone. Well, it's non-verbal, so that's not going to work. iPads, no, for people with dementia, not any good. No. He couldn't see it anyway, so so what was the point in that? No.
Did that not seem to be appreciated by the care home? That would not be a proper way of, as a sensible way of communicating.
Yeah, they did say this is just stupid. But at the start of the pandemic, there actually wasn't even broadband in the unit Jim was in the care home. Right. So I think they were tethering it up to their own phones, the staff. But it just wasn't of any use.
Yeah. You also, I think, as we can see from paragraph 32, you phoned regularly to find out how Jim was. Understandably.
Every day.
And you indicate, I think it's something we've heard before, is that you got the reply usually that he was fine.
Yeah, what does fine mean?
Yes.
You know, it would depend very much what member of staff answered the phone, but you would usually get, oh, he's fine, he's sitting listening to his music, he's fine. But that really didn't tell me. Jim didn't have good skin, whether his skin was infected or whether he'd eaten his dinner, it didn't tell me anything.
And we've heard from a number of witnesses, and I'd just ask you in this context, did you feel a bit of a nuisance phoning all the time?
Very much so, and I was told on a few occasions we're really busy. We've not got enough staff. We're really busy. We can't just be answering the phone all day.
Yeah. Okay. You did see your husband, I think, for a couple of minutes, because his father was also in the care home, and I think his father died.
His dad did, yes. Yeah. His father was admitted to the same care home but a different unit because of mobility issues, and I had got a phone call to say that the care home were in lockdown at that point, that his father was very ill. So I immediately said, well, I want to be there for him. So they said, yeah, do a test, just come down. So when I went down and I was sitting with him, I was told, well, you can't just sit here all day. And this man's dying, you know. So I said, well, his dad was mentally fine. I said, his dad, he wants to see Jim. It's one of the things we kind of said, oh, you know, when he went in, oh, you'll be able to see Jim, you know, it'll be great, you'll be able to see, you know, your son. And he hadn't seen his son because that would mean taking one person from one unit over to the other and infection control and all, whatever. So I went on and on and on about it. His dad needs to see his son, he needs to see him. So eventually they said, okay, we'll bring him over. Well, it was 8 o'clock at night. It was, the weather was horrendous. It was wet. He was in a wheelchair. Jim didn't understand what was going on. And it wasn't for Jim's benefit, it was for his dad's benefit. Yes. And he wasn't happy when he came in and he started shouting and whatever, you know, to express that he wasn't happy. And his dad just couldn't understand it. What's wrong with Jim? Why is he like that? And then basically I just had to say, look, just take him away. His dad had seen him, but it was awful. And just the whole weren't allowed, you know, your time's very limited here. You can't sit with them.
So if, in brutal terms, it was probably of little benefit to either Jim or his father. Probably,
but at least his dad saw him.
He did it, yeah. At paragraph 35, you mentioned that you found out that care home residents were not allowed to be out of their rooms, and in particular weren't allowed to go into the lounge area. Yeah. How did you find that out?
I'd got a phone call one Friday afternoon to say that the local council had instructed that all residents were to remain in their rooms. And I just said, absolutely not. That's not happening to Jim. And I was very firm. And the reply I got, well, that's fine. We'll just put it in his care plan. Jim's to go through to the lounge. The lounge area was bigger than this room. He wasn't anywhere near anybody. It was easy to isolate people in the room. And he had his music and his comfy chair. And he wasn't anywhere near anybody. So I said, absolutely not. I mean, if he'd been stuck in his room, he would have been stuck in his bed at that point.
Was that pleading on his behalf?
Yeah, absolutely.
Any use?
Yes, it was. I just put my foot down and said, well, it's not happening.
But does that mean that he went? I appreciate that he would have been in his bed if he was in his room, whereas in the lounge he could sit in a comfy chair. Yeah. If what you say, as I understand what you're saying is the case, there'd be no other residents in the room, so he'd be sitting in a lounge room all on his own, albeit in a comfy chair.
But at least he was getting a walk from his room to, you know, he was still using his legs. If you're stuck in your bed, your mobility goes very quickly.
None of that, as far as you're aware.
As far as I was aware, because I wasn't in, I don't know. Yeah, I know. Rooms. Certainly, once visiting did resume, I asked where a few of the residents were, and it was ones that kind of generally walked about a lot, and I was told, oh, they get put to their bed and they died, not of COVID, but of something else.
Sorry, Mr.
Thank you, Lord. Paragraph 36, you mention your 30th wedding anniversary
Yeah.
on the 18th of September 2021. And obviously that was a date you wanted to share with Jim in some way.
Yeah.
And I think you were given, you were, as you put it, sneaked in
I was
to the unit by somebody.
Yeah.
And I think you were very grateful for that.
I was extremely grateful, yeah, that I was able to spend some time with him. I didn't stay long, but I was still able to. Not that Jim understood, I don't think, for a minute, but I did.
You also talk about visits in a corridor, and you indicate that during these visits, Jim became very distressed.
He did. The corridor was an outside corridor. Well, it was a corridor through to the offices, and where the care home sits, it sits up very high. It's got fantastic views towards Arran. When you were making an appointment, you had to make an appointment, and you don't know what the weather's going to be like. So he was wrapped up in a wheelchair, not understanding why he was taken out his comfort zone. And the wind was howling in round about him. There was another staff member there. I was outside, and he just kicked off. He just started shouting and screaming. And what can you do? I just have to walk away. I'm not watching anybody being distressed.
And just to be clear, that was part of his condition.
Well, it was his way of communicating.
Yes.
It wasn't really. Jim was the most docile person you could ever meet, but it was the only way he could communicate and tell people he wasn't happy. Was somehow he managed to find swear words. I don't know how he managed that, but he never swore in his life, but he did then. And he would try to get up, and get very distressed, and I wasn't going to watch that.
Yeah. And I think also in paragraph 38 you mentioned that trying to see him through a window wasn't particularly useful either. Yeah,
well, his room was, although it was ground floor, there was actually metal fencing right round, so he would had to go kind of get in through the gate and lock. It was all double locked and whatever, so you couldn't actually have seen in the window unless you had a set of step ladders anyway. But we tried in the lounge area. There was patio windows which opened up and you could see the whole view. The unit manager, she would open it a wee bit for but again it was windy, it was cold. It didn't like that either. But if the overall manager was anywhere near, that would get shut. So how can you communicate with anybody? He couldn't hear my voice through a double glazed window and the wind. And so I had to give that up as well because it really just didn't work.
I think you make the comment at paragraph 37 in the last sentence. You say, I didn't understand why they weren't more prepared for these visits when it had been announced that they could happen.
Yeah, when visiting did open up, and the guidance always came out on a Friday at lunchtime. The office staff are not there. They disappear early on a Friday, and any time it was usually me that telling the care home that there was new guidance out, and the answer would always be, oh, we've not got it yet, or we need to read it thoroughly and then get agreement for anything with public health. And that I just couldn't understand why we'd been closed for all these weeks, and they knew visiting was going to open up at some point, so why was that not all prepared? Why did it then take 2 weeks for public health, who had every care home to to agree they're visiting and all that? Why did it take that 2 weeks when again we couldn't see our loved ones?
there was a degree of recognition, well, perhaps a degree of recognition, you mention it in paragraph 39, is that if he was told that you were coming to visit, he would smile.
He would, yeah. Or if, it used to be, it was when I walked along the corridor, and I would usually be chatting to staff or some of the other residents, and, if you turned the corner and you could see his face, you could see that he heard my voice, and he had a wee smile on his face.
Okay, that's nice. You became a designated visitor, I think, when that was introduced, and that after you'd had, you had access to COVID tests, and that enabled you to see him inside.
Yes, I had spent my time phoning public health, phoning the Care Commission, phoning anybody that would even listen to me. And both Public Health and the Care Commission, when I described Jim's condition, they all said, absolutely, you should be the designated visitor, you should be getting in. His condition allows it. But the care home very much were, well, no, Right. And it was only after a lot of pleading, a lot of shouting, that they actually listened to me, and they did let me in. But I through my work, I had COVID tests. We were testing at least twice weekly from my work, and I also ordered some online. So I'd be testing every day. We had to test as well before we went into the care home, so or when we were there, depending on what staff member was on, whether she trusted you or not to do it before you went in. Some insisted you did one and then waited half an hour out in the car, and others let me do it before I came down.
How did you find out about designated visitors? Did you find that out from the care home?
No. They weren't letting anything like that away to anybody, because if I found out about that, then, if I was frequently told, oh, everybody will want that, and we can't cope with that. I'm pretty sure I found out about it through the Care Home Relatives Scotland Facebook page.
Okay. And there seems to have been not a consistency in the meetings that you had with Jim within the care home. Sometimes it would work, sometimes it wouldn't.
Yeah, you just never knew which. That's his condition that caused that.
Yeah. You do mention at paragraph 42, and I'd just like to ask you about this. Jim was frequently in a wheelchair, as I understand it.
At that point, yeah.
Yep. And you say that you were aware that his posture wasn't good.
Yeah.
Could you explain how you became aware of that and what the problem was?
Yes. By that time, I had been allowed. We had about 5 different managers throughout the pandemic, the care home, and every time there was a change of manager, I had to explain Jim's condition. So there was one of the managers had agreed with me that I could go into the lounge area and sit with Jim, and that worked really well, because he wasn't needing to be moved, he wasn't distressed, he still had his music, and then an area manager was down, and when I got there, they were like, Alina, you can't come through to the lounge today. And I'm like, why? And you need to go into the visitors' room because this area manager's saying. So Jim was put in a wheelchair, taken through to the visitors' room. I had tried speaking to this area manager, but she just wasn't for listening. He was leaning out the wheelchair. He was screaming and bawling and shouting. She actually phoned me while we were in the midst of this, and I actually was really annoyed. I was like, my husband's about to fall out this wheelchair because of what you've done to him, and her reply was, oh, I better get off the phone then. And I never spoke to her again.
Okay. Do you attribute the change in his posture to anything in particular?
Yeah, I think it was probably a decline in his illness, yes. A decline in, when people are walking, if they're getting plenty of exercise. They're standing up straight. Your muscles on your back are getting used. If you're just sitting in a chair, you're slouching. I think it was probably fatigue within his muscles and a lack.
Was he mobile at that time at all?
With assistance.
Okay.
The corridors in the care home were quite long. It was quite a, I mean, not a massive walk to you and I, but to him it was quite a walk. And we kind of felt that his legs would maybe give way, so that's why he was then put in a wheelchair.
And I think we can see from paragraph 42 that it was not long after this that it was agreed that Jim should remain in bed for his own safety, as his mobility had become very poor.
Yes, if he was getting distressed, he was trying to get up. And we felt that if he did do that, he was at risk of a fall, and the last place I wanted him was in a hospital with a broken hip or whatever. Yes. So I had always said from the very, very beginning that I do not want Jim in a hoist. I use hoists for my work. I know they're not nice to be in. So I always said, well, Jim, with his eyesight, his dementia, he wouldn't understand the whole hoisting thing. So if it got to that stage, he would be in his bed. Okay. And actually he was happier in his bed. And when we look back, we think that was the right decision to do.
Yeah, you make an interesting comment in paragraph 43 of your statement. Perhaps you can explain what you mean by that. You say the care home made me feel like a criminal for wanting to see Jim. Every time I tried to visit, it failed as Jim got distressed, swearing and shouting, and he tried to walk. He was in severe danger of having a bad fall. Yeah. Why did you feel like a criminal?
Some of the comments that were made to me, especially if you had to make an appointment, sometimes I think I was just constantly on their backs. And I think because I was a wee bit younger, I was more able to do that, whereas some of the other residents, maybe their wives, husbands, whatever, were elderly and they just kind of accepted it. And particularly the office staff and the overall manager, it was like, Alina, we can't let you do that, because everybody will want to do that. You know, everybody will want to feed their family member. You just can't be doing that. And it's just some of the comments were really not nice.
Did you feel they were personally directed at you?
Yeah. I think because I was asking probably for more, just to get inside, to be able to give him his dinner, to be able to. No, we can't. You just can't be doing that.
Were you a bit vulture?
Yeah, I was. But hey, do you know it's your husband?
Yeah, understand. Now, you do mention a visit from Jim's doctor, and grateful if you don't name the doctor. But you arranged for a visit from his doctor, and I think his doctor lived quite close to you.
His GP, he'd moved medical practice when he went into the care home, but his GP stays 3 doors down from me. So he's got a dog, I've got a dog. So if we were out walking the dogs, he would often say, have you seen Jim yet? And I would say no, and he would shake his head and just say, oh, that's ridiculous. So when there was a period of I hadn't seen him for quite a while, and he knew Jim's condition, he said, look, he says, I'll go in. And he said, I think Jim must be needing a review of his medication anyway. He said, I'll go in. So I got a phone call from the care home manager, absolutely not happy at all. You've asked someone to go in here, and that's someone that doesn't need to be in this care home. I said, well, I'm very sorry, but I haven't seen my husband for weeks. I want someone checking up on him. But they were so unhappy that I had done that. But I had informed them that he was going in, and by email.
Yes. And your doctor, Jim's doctor did go in.
He did.
He was able to see him, although not particularly close contact, wasn't it?
No, he was able to see him, and he said he did look a bit thinner, but it's difficult to know when you're only seeing somebody just for a very brief period.
Well, how did you feel about the difficulty that you experienced in getting a GP visit to Jim?
Oh, it was terrible. Because his GP was my neighbour, then I've got 2 GPs that are neighbours. And, you know, so I was fortunate that I could, you know, if I was worried about anything, I could speak to them. But I really don't think there was GPs going into the care home much at all.
Yeah. Can we just look at, I don't want you to read through them, but paragraphs 47 and 48, you mentioned guidance. And I think it's picking up something, and I think you've already referred to this, that where changes in guidance came about, and in particular where those changes in guidance led to lifting of restrictions, how did you find out about that?
Usually through the Care Home Relatives Scotland Facebook page. I would immediately phone up the care home and I would be told, but we haven't received them yet. Or if they had received them, we haven't had time to read them and process what's in them. One minute they were saying to me, but it's only guidance, we don't need to go by them. And then the next minute they were saying, oh, but we need to follow that. So it was kind of depended which, you know, what it was you were wanting. Sometimes I just felt as if I was always telling them what they should be doing instead of, and I had to ask them, could you think you could send an email out to the families? And I remember in particular having a really strong argument with one of the managers who said to me, we have sent an email out. And I said, well, I haven't received it. And if I haven't received it, then probably nobody else has received it. I can assure you it has been sent out. And I said, well, I definitely haven't received it. And she did come back later in that day and apologise and say, no, I believe it hasn't been sent out. And they then sent it out. But there was not really any communication, not very, very little from the care home regarding visiting or anything that was happening.
Did you feel sympathy for the care home in the position that they were placed in trying to accommodate constant changes in guidance and get that guidance out to people?
No, because I felt sorry for the actual staff that did the caring, but not for the management and not for the office staff. I never felt any sympathy at all, because I felt it could have been far better communication, and it could have been handled so much better.
Yeah. And you mentioned, and you have mentioned, the habit, as it appears, and we've heard more about this from other witnesses, of issuing guidance on a Friday afternoon.
Yeah, nobody's there on a Friday afternoon, and the carers can't do anything, so it has to be the office, the manager, and often they would finish early on a Friday, or wouldn't be in on a Friday sometimes, or working from home.
Could you just go to paragraph 52, please, and just read that out so that we know we have it in your voice.
I don't feel that the isolation that came about because of the restrictions was appropriate or proportionate. I wouldn't have allowed it.
Yeah. In making that observation, are you bringing to bear your experience as a carer?
Yeah, I mean, if I was able to go into people's houses with the correct infection control mechanisms, then why couldn't I go and visit my husband? His room was near the door. I was going straight there. I had my full PPE on. I'd tested. The staff were going out, you know, once things had opened up a bit, the staff were going out and meeting their families. Why couldn't I do that? Why couldn't I visit my husband?
Yeah, I suppose the contrary argument might be that they were taking a precautionary approach to matters and attempting to protect other residents from the possibility of somebody coming in and carrying the virus. Yeah. Do you have any sympathy or appreciation of that? There was lots of times when as I drove into the car park, the office manager's office
and window looked right onto the car park, so she would see me coming in. And sometimes I would walk round to the unit and they would be like, Alina, we've got an outbreak, you can't come in. So, well, who's telling me this? Nobody's telling me this. I've turned up. So I would go round to the office and say, look, you know, my husband's got a right to a family life. He's got a right to see me. And always the reply would be, yes, but the other residents have got a right to be safe. Can't argue with that. But, yeah, it was very, very
Do you think it was possible that your own job might have had some influence on this? I think you perhaps allude to this paragraph 67 of your statement. You say one of the reasons they thought I was a risk was because of my job, as I was going in and out of other people's houses, but my work were very good. And if they knew that somebody on my rota had COVID, then they were happy to tell me not to go as they knew my circumstances.
Yeah.
And presumably you were also, and I think you've told us this, you were also wearing full PPE and you were testing regularly.
Yeah. Yeah. My work were extremely good. We were told at the beginning we can't refuse to go into someone with COVID. However, they were sympathetic, very sympathetic to my situation, and if I found out any of my service users had COVID, I would just phone up the office and they would say, right, it's okay, we'll get that changed for you, and they would put me into someone else rather than the person with the COVID.
You became aware, I think, that Jim was declining in health. I think you say that at paragraph 54. And I think you, throughout this period, as you put, constantly complaining, begging, and threatening lawyers. Did you actually ever do anything about engaging a lawyer?
No, because I didn't know who to phone.
Okay. And how were you aware that Jim was declining in health?
Well, sometimes the unit manager would send me a photograph of Jim, and I could see he was getting thinner. I could see his posture was not good. By the time he was in his bed, I was getting in to his room to see him, and I could tell just his whole look. He's sleeping more. He was eating less. Swallowing became difficult.
Yeah. Now, I think you tell us at paragraph 56 and following that your eldest son was particularly upset during this period.
Yeah.
Did he get to see his father during this period?
Yes, he did. It was, I think, because he was the eldest and he'd done so much with his dad that he knew his dad the best, better than the other two. He has certainly taken it worse. When he was able to go and see him, it took me 5 attempts for him to get out the car in the car park, because as soon as you would drive in, he would just be in floods of tears. Eventually his girlfriend persuaded him, and she came with us to see him. But and certainly prior to Jim's death, he was there every day.
I mentioned earlier your daughter. Paragraph 57, you mentioned this incident. Just tell us about it, please. What you say at 57?
Yeah, my daughter, when she was at school, she was playing for the Scotland team. She was offered plenty of scholarships to go to America and do her studying and play golf there, but she wouldn't go because she was worried that her dad would forget her. And she went to Edinburgh University and then on to Stirling. But she just couldn't bear being that distance away from her dad. And before COVID, we had an incident where we were in Wales and she was competing, and we'd got a phone call to say that Jim had 10 minutes to live. and they had called it, well, actually, we got the phone call to say they'd called the doctor because his observations, his oxygen levels weren't good, and the doctor phoned me and said he's 10 minutes to live, and in hindsight, you would think, well, why would you even think of moving somebody that's got 10 minutes to live out, you know? So I'd had a glass of wine, which I never did, but at that time I did. So Louise she must have been 17, she was driving, we left, we were bombing up the road, and I couldn't argue with the doctor because it was all in his care plan that he wasn't to go to the hospital, what was to happen, but she wasn't for listening. And because Louise was driving, I didn't want to have any arguments. So eventually I said, OK, take him to hospital. His brother went down and basically took him out of the hospital because he was kicking off. He wouldn't keep the oxygen on. When I arrived at 3 o'clock in the morning, he was sound asleep in his bed. He lived 3 years after that, you know, so.
A little premature.
Yeah. But yeah, she wouldn't, she was just absolutely devastated. That.
Well, tell us about the occasion when I suppose some clarity, so far as Jim was concerned, reigned, and you realised what was going on the television.
Yeah. When Louise was playing in the British Amateur, and it was during COVID, I wasn't allowed to go. It was in a local course, and I was only allowed there for the final, and along with 25 others. But it was all recorded on Sky Sports, and I had, after it, when she had won it, she'd won by the greatest margin there had ever been. And when I went back into the care home, I put it on my phone and let Jim listen to the commentary. And at one point, they were talking, the commentator had said, "Can she do it?" And Jim went, "Oh, yeah." And that was just something he hadn't managed to speak, but he managed to get that out. So I am kind of aware. And then when she was playing at the British Open, I did the same. And, I just always put it on my phone and let him listen. And they, mentioned her name a lot. And I think he was kind of aware.
Yeah. Thank you. I'd like to ask you a little bit about paragraph 61 and 62 of your statement. You were obviously a regular correspondent. It's your word,
yeah,
Mrs. Duncan, and but you were obviously a regular communicator with various organisations, and I think you've said that you phoned the Care Commission and Public Health, who both stated that due to Jim's condition, particularly being blind and unable to communicate, I should get access to him. But the management of the care home continually stated that I was not essential to his well-being. And you say the evidence proves otherwise.
Yeah, at one point I was told, well, why do you want to go and see him? Because you don't do anything anyway. And I thought, well, nobody's ever going to say that to me again. So I started giving him his meals. So I would finish work, I did split shifts, finish work at 12 o'clock or 12:30, go straight down, give him his lunch. I would go back at 4 o'clock, give him his dinner. I thought, but this time they weren't restricting me much. But I was under the impression that I was helping out the care home because they didn't need to feed him. I was making sure he was eating and what he was eating, and I was getting contact.
And I think there was an incident you refer to in paragraph 63 of your statement where you had to go and get a bib for him.
Yeah.
And this was observed, and there was some kickback about that.
I had gone in one lunchtime, and by that time I was often when I was in Jim's room, and then they would bring his lunch or his dinner through to me, and they would maybe just bring one course, and I would have to say, "Is Jim not getting any pudding today?" "Oh, sorry, we forgot." So they would go and get it and bring it back. So I started going through to the trolley in the lounge area, which was all covered by CCTV by that time. And I went back, got his meal. I asked one of the staff members, is it okay if I make Jim a drink? And they said, yeah, go ahead. So I was always handed the food. I never went into any food. And also I would never have eaten the food myself because I didn't like it, but that was besides the point. But so I went back to his room, put his food in, and I went to get a kind of bib thing that they used, and they were in a locked cupboard. And just at that, in the front door came a assistant manager, someone else, and a wee old dog that followed the assistant manager about. And she just laid straight in. I said, well, can you get into that cupboard, and because it was numbered codes, and get me a bib for Jim? And she just laid right into me. Right, we have seen you taking food from that food trolley. You can't be doing that. You're an infection risk. And I'm thinking, oh, well, wait a minute, your dog who's wandering about here's not an infection. But I thought, I better not say anything. So, of course, I get really, really upset, and I just left. The following day, somebody had said to me they'd been at a management meeting, and they'd said, this person had said that I had taken food from the food trolley. And I said, well, I can assure you I certainly didn't. Anything I was handed, and I asked if I could make a drink, and it was fine. So I put an email in explaining what had happened, asking for a meeting with the overall manager. Not once did they ever reply to any of my emails by email. It was always when I pulled into the car park, somebody would come out the office to come and get you. Oh, the manager wants to speak to you or whatever. So the secretary came running out. Oh, I have to make an appointment for you to come in. So I said, well, bring in my brother. That's fine. So when I went in, fair dues, they had looked at the CCTV. I'd done absolutely nothing wrong, and I got an apology and told. I'd actually phoned up the Care Commission thinking I was wrong, and the Care Commission said, you're joking? You're helping them out, and they're saying this to you? And they're like, no, don't be daft. So we did get an apology.
Okay. Now, you provide us with some information on infection control and prevention, and we can obviously read through that. Just one point to take from that section of your statement, paragraph 71, you say you think that overall the care home lost about 20 residents to COVID. Where do you get that information from?
There was I think one of the managers told me, but there was a garden, a memorial garden set up, and they had a wee kind of service, which was, it was nice, and it's got beautiful views, and the bench I bought was next to it, but it's disappeared. So, yeah, I'm sure it was one of the... I
think you say that Jim didn't get COVID, but you don't really know how.
I don't know how. Unless he was non-symptomatic, because he wasn't very happy when he had to get tested, so I eventually said, no, don't put him through that. He's not anywhere near anyone else. You know, he just didn't understand why they were putting things down his throat and up his nose. And so eventually I just said no.
Was testing difficult for him? Did he test?
Yeah, very much so.
You have a passage about do not resuscitate notices.
Yes.
That was something that Jim had put in place.
Yes, he had. When he was diagnosed, he actually said himself that he wished he'd had a brain tumour because it would have been quicker. And he also told his social worker that he wished he could have just taken a blue pill and ended it all. But he went to the doctor on his own when he was still at home, and he completed his full DNA CPR. And that was just, I updated it every...
So you were aware of that?
Yes.
And it was a decision that he had taken, presumably in consultation with you?
Absolutely.
Now, you tell us about the period immediately before Jim's death, and I realise this will be distressing for you to read over it, and I don't want to take you through it in any detail. But I think from your own experience as a carer, you knew that Jim was dying.
Yes, I could see that he was struggling to swallow. He was starting to choke. As a carer, I know what foods you can give to people in that situation. So he lived off of puddings and Karamat bars, which are no longer going to be made. So I'm glad he's not here. But yeah, it was just things like that. And I could see it getting worse and worse.
Yeah. And I think on the last day of his life, you'd phoned in the morning and told that he was washed and fine.
Yeah.
And you walked in just after 11 a.m., I think. This is paragraph 82. And you saw that his mouth was...
that week, because he was on no fluids by that time, every single time I walked in, he was distressed. Now, I care for people in the community that are dying. I know we have fantastic district nurses in our area who worked right throughout COVID, and we're basically the only ones, apart from ourselves, going into people's houses. I know how settled people should be with the right medication. So I was constantly on their back saying, Jim needs more medication. Jim needs something to settle him. And I've totally felt every time I asked for a nurse that I was being a nuisance. So on the day, myself and my son had been there all week, and Louise was in Sweden competing. I kind of wanted her away from the situation because I knew what was going to happen. So our boyfriend was going with her, so I thought, well, let's just get someone with her. So my son had phoned and I said, look, don't come down. This is not nice. I'd walked past a management meeting. I'd phoned at 2 o'clock in the morning. I'd phoned at 8 o'clock in the morning. I was told he was absolutely fine. He had been washed. He was fine, so I didn't rush down. So I walked in just after 11. I'd walked past a management meeting, and I walked into his room, and what I saw, I was horrified, absolutely horrified. He was in a terrible state. He was really distressed. His mouth was all dry. It was brown, and his chest was rattling. And I knew myself, this is not going to be long, but he needed more medication. So I think
you say in paragraph 84 and following that there was a problem trying to get that medication. And I think you were annoyed about that.
I was very annoyed. Yes, I was told, I went through to the lounge and I said to one of the young staff members, can you get a nurse here? Oh, I'm sorry, they're all at a meeting at the moment. I said, I don't really care. I said, I want a nurse here now. And to be fair, and the girl, she did go over and get them, and the nurse came over and she gave him an injection. He was already on a syringe driver by that time, which the district nurses are the ones that attend to that and increase medication for that. And they come in every 24 hours and top it up, and it's all locked away in a wee kind of box. Anyway, the nurse told me, well, Jim's only got one more of these injections that I can give him today. And I said, well, I don't really care. You'll need to get on to the GP and the district nurse. So, OK, that's fine. We've left a message for the district nurse. And I know that I have the phone numbers for the district nurses in my village where I stay, the mobile numbers, because I know that they're only in the GP surgery before they go out on their rounds and at lunchtime and after to pick up any messages. So they said, well, we've left a message for the district nurse, but they're not going to be there till lunchtime. Well, we can't do anything more. So I said, well, you need to phone a GP. So they did, and the GP phoned back, said, yes, I've agreed to an increase in medication. But then the care home said, well, the district nurse has got to come in, pick up some card thing, get it signed, take it down to the doctor's surgery, get it signed, and then come back and administer it. And I'm, well, how long is this going to take? So anyway, by that time, my son had texted my brother, and my brother had come in and was sitting with me, and I knew it wasn't going to be long, but the last half hour, he he just settled and passed. But under normal circumstances, I would have stayed with him until the GP had come out to certify his death. But I was so angry that I just had to leave. When I went through to the office and I said, Jim's passed, and they just looked at me. And they said, Jim's passed? I said, yes. And they just, oh, we better get a nurse then. Could you not see what was happening here? You know? And I'm angry to this day.
Yeah. And you tell us about that in paragraph 87 of your statement. And you, I suppose one can say, at least were with him when he died.
Yeah.
You tell us about the impacts at paragraph 88 and following. Particularly, as I was earlier, interested in the impact on your children.
Yeah.
You said they struggled to visit after COVID due to the severe decline in their dad. And you said it took 5 visits to the car park before your eldest would see his dad because he was so upset.
Yep.
The continuing restriction and lockdown and inability to see their father, how would you say that has had any long-term effects on your children? Probably
yes. When the care home opened up for visiting, myself, my daughter and my middle child were always staying in the same house, and I kept asking, can the kids come and see him? And no, it's only one person allowed. But I can't. Jim had deteriorated so much through that period. I said, the kids are really, really upset. I can't ask them to go in on their own and see their dad in that situation. I didn't know how his behaviour would be. He might be shouting, screaming, whatever. I have always protected them against seeing that, because I don't think it's nice for anybody to see their father as distressed as that. And I just didn't want that. So basically they couldn't go until I was allowed to go with them. And I think when you're seeing somebody day in, day out, you're not noticing the changes quite so much. But I think because there'd been such a long period, they did notice it. And yeah, I mean, they talk of their dad very fondly, but there's lots of times that they just don't know about their dad, but what he did, what he's, you know, and they'll want to say to me, oh, what happened then, you know, or what was Dad doing? Every day they did ask about their dad, you know, how's Dad today? And I would say, yeah, he's fine. But I wasn't going to tell them he was distressed. He wasn't.
You're repeating what you were told.
Exactly, I know.
Yes, fine. Yeah.
I know. But I wasn't going to tell him that he maybe wasn't eating or he was distressed. You know, you try and protect your kids as much as you can.
Of course. Would you go to paragraph 90 in your statement? And I'd like you to read, so we have it in your own words, from 90 through to 93 of your statement.
In my opinion, the Scottish Government and the care home management should have considered quality of life, not quantity. Management used government legislation and public health rules to hide behind and keep relatives out. Many times I quoted the Human Rights Act. However, I was always told that the other residents had a right to be kept safe. Through the whole period, the staff in the unit had been fantastic. However, management have not taken individual circumstances into account, and not taken into account the fact that my husband was in the last stage of his illness. I kept having to say, I'm not reading this now, but that Jim could potentially, we didn't know when it was going to happen, but it was going to happen. Yes. And nobody listened. Do you want me to read on?
If you would.
During his illness, when I couldn't see him, I was unable to tell him what his children were doing and how proud of them he should be. After a while, it became too late. My husband passed away not of COVID, but his illness, and I regret every day not being with him in the last 2 years of his life.
Would you just read on, I'm sorry I cut you off there, but would you read on 94 and 95, please?
I want to be included in the inquiry as care home residents have been treated, in my opinion, as worst of all by the Scottish Government and the managers of the homes. Nobody should have to do without their families by their side to be their voices and just be there for them when they're suffering enough with horrendous illnesses and possibly at the last stages of their life.
Yeah. You set out a couple of paragraphs of your hopes for the inquiry, and principal of those hopes are that the inquiry supports Anne's law as as it was proposed, rather than as it's now currently proposed in the bill.
Yeah.
Yeah. And I think you also say, Mrs. Duncan, that you have a number of emails and other documents that you can provide to the inquiry. And can I just say that the inquiry team will be in touch with you to get those documents, if they haven't already been sent.
Yeah, some of them I have not been able to get. I put in a subject access request, but I haven't received any documents for that. But I have other ones that I will pass on.
Yes, well, we would be grateful to receive those. Mrs. Duncan, thank you very much. Is there anything else that we haven't covered in this statement that you'd like to briefly say?
I don't think so.
Well, thank you very much for your time.
Thank you, Mrs. Duncan.
Thank you.
Right, 2 o'clock.
2 o'clock, my lord, yes.
Very good.